The threat posed by fungal infections is often overshadowed by more visible health crises. Yet emerging research is revealing a deeply concerning link between climate change and the global spread of these silent killers. One group of fungi, Aspergillus, could expand its reach across Europe, Asia, and the Americas, putting millions more people at risk for serious illness. With millions already infected by these fungi each year, this expanding danger should not be underestimated. Aspergillus is responsible for a growing number of infections worldwide, contributing to the deaths of nearly 4 million people annually. These fungi are especially perilous due to their stealthy spores, the difficulty in diagnosing the diseases they cause, and the increasing resistance to the few treatments that exist. The spread of Aspergillus is a particularly alarming consequence of climate change. Rising temperatures, coupled with shifts in precipitation patterns, are rapidly changing the geographical ranges of many deadly pathogens, including fungi. What is particularly troubling is the long-term trend predicted by experts. As the planet warms, these fungi could reach new territories, infecting populations that previously had little exposure. For example, by the year 2100, the Aspergillus fumigatus species, one of the most dangerous strains, is projected to spread to new regions, including areas closer to the North Pole. This will expose millions of people in Europe, Asia, and North America to a greater risk of infection, which could lead to a higher incidence of life-threatening diseases. In particular, Aspergillus fumigatus is a major cause of aspergillosis, a lung disease that can spread to other organs, including the brain. One of the greatest challenges with this disease is its late detection. Many cases are either misdiagnosed or go unnoticed until the infection has already spread. Early symptoms often mimic those of other, more common respiratory conditions, meaning medical professionals might not immediately consider fungal infections as a potential cause. This lack of awareness, coupled with limited treatment options, makes Aspergillus infections incredibly dangerous. While people with compromised immune systems, such as those with asthma, cystic fibrosis, or those undergoing chemotherapy, are particularly vulnerable, anyone can potentially be affected, and the damage can be severe. Aspergillus fumigatus is not the only harmful species on the rise. Aspergillus flavus, another dangerous fungus, is likely to expand its reach due to climate change, potentially threatening even more areas. This species is especially concerning because it produces aflatoxins, highly toxic chemicals that can cause liver damage and increase the risk of cancer. As temperatures rise and carbon dioxide levels increase, the production of these toxins is expected to increase, exacerbating the already significant threats to human health. This could make already vulnerable populations even more susceptible to severe health consequences. Worse, Aspergillus flavus has demonstrated a worrying trend toward developing resistance to antifungal drugs, further complicating treatment efforts. The lack of investment in antifungal medication research means that we are woefully unprepared to handle the rising tide of fungal infections. The consequences of this fungal expansion are not limited to human health. The agricultural industry is also at risk, with Aspergillus flavus thriving on crops, particularly in warmer climates. This could have disastrous effects on food security, as the fungus could contaminate food supplies with aflatoxins, leading to both health and economic crises. Some regions, like North China, Russia, and Alaska, will experience new outbreaks of this deadly pathogen, while others, including parts of Africa and Brazil, may see the fungus disappear entirely, disrupting the local ecosystems. While this might sound like a positive outcome for some areas, it is important to note that Aspergillus plays a crucial role in breaking down organic material and recycling nutrients in these ecosystems. Its removal could lead to unforeseen ecological consequences. Climate change isn't just affecting fungal pathogens directly, it's also exacerbating environmental factors that contribute to their spread. Extreme weather events, such as droughts followed by heavy rain, are known to disturb the soil and release fungal spores into the air, allowing the fungi to spread more easily. The increase in wildfires, which are becoming more frequent and intense due to higher temperatures and changing rainfall patterns, is another key driver of fungal proliferation. These fires release spores into the atmosphere, making it easier for fungi to travel across large distances and infect new areas. Furthermore, fungal infections like aspergillosis are spreading more rapidly in certain demographic groups. In particular, rural communities and Latino populations have experienced higher rates of infection, potentially exacerbated by limited access to healthcare or delays in receiving proper treatment. The impact of fungal infections is likely to be far-reaching, not just in terms of the number of people who become ill, but also in the strain it will place on healthcare systems. Fungal diseases are difficult to diagnose and treat, and with the rapid spread of these pathogens, doctors may be overwhelmed by the sheer number of cases. The already limited resources for fungal infection research and treatment may become even more strained, making it harder to control outbreaks. Additionally, with fungi evolving resistance to current treatments, the danger is compounded by the diminishing efficacy of existing antifungal medications. The global healthcare community is woefully unprepared for the scale of the problem, and there's a clear need for increased investment in research and development to address the challenges posed by fungi. The scenario described in this research paints a grim picture for the future. As climate change accelerates, the spread of deadly fungi like aspergillus could become a major public health crisis. The projected rise in infections, combined with the growing difficulty of treatment due to drug resistance, creates a perfect storm of challenges that could overwhelm healthcare systems worldwide. What's worse, the slow nature of fungal infections means that many cases will go undiagnosed until it is too late. The human toll could be immense, and the economic and ecological consequences could be equally devastating. This looming threat is often underestimated, but it is becoming increasingly clear that fungi will play a major role in the future of global health crises. With the climate crisis continuing to unfold, the spread of fungi like aspergillus should be taken more seriously by governments, healthcare providers, and researchers alike. The growing risk of fungal infections is an urgent call for action, not just to address the immediate health threats, but also to mitigate the long-term consequences of a warming world. The time to act is now, before we find ourselves facing an uncontrollable outbreak of deadly fungal diseases. Without greater awareness and preparedness, the world could be left struggling to cope with a rapidly spreading fungal menace that thrives in a changing climate.